Heart attacks. A heart attack, or MI, which stands for myocardial infarction, is a serious medical emergency in which the supply of blood to the heart is suddenly stopped, and it's usually caused by a blood clot. Now, people often think a heart attack and a cardiac arrest are the same thing, but they're not. If someone's having a heart attack, they're conscious, whereas if someone's in cardiac arrest, it means they're unconscious because the heart is completely stopped. Now, a heart attack is a medical emergency, and as soon as we suspect somebody's having a heart attack, we must call 999 and we must get them on the floor and sit them in the W position. A heart attack is a medical emergency because a lack of blood to the heart may seriously damage the heart muscle, and it can obviously be life-threatening. Symptoms of a heart attack can vary, but they can include pain, normally in the centre of the chest. It can feel like it's being pressed or squeezed by a heavy object, and pain can radiate from the chest to the jaw, to the neck, to the arms and the back. They may also experience shortness of breath. They may feel weakness on one side of the body. They might feel a great sense of overwhelmment or anxiety. They might be sick or feel sick. They might go very pale in colour. They just generally look unwell. Now, it's important to note that not everyone experiences this severe chest pain. And this is particularly the case with many women. The pain can often be mild and mistaken sometimes for indigestion. It's a combination of symptoms that's important in determining whether a person is having a heart attack and not the severity of actually the chest pain. Treating a heart attack. Now, as we said, we call the ambulance as soon as someone is showing signs or symptoms of a heart attack. And we're getting them sitting on the floor in the W position because if they suddenly stop breathing, we might need to do CPR to them. And if they're on the floor already, all we need to do is just lay them flat and then begin CPR, which we have talked about in a previous video. Sometimes they might have a spray. They must spray underneath their tongue. Encourage them to take that. When the ambulance come, they will do various tests on them, and they will probably take them into hospital. And in hospital, treatment for a heart attack just depends on how serious it was, but there are two main types of treatments. One treatment will be using medicines to dissolve the blood clots, or surgery to be able to help restore the blood to the heart. Now, you might be thinking, why does somebody actually have a heart attack? Well, coronary heart disease, CHD, is a leading cause of heart attacks. So CHD is a condition where the major blood vessels that supply the heart get just clogged up with deposits of cholesterol, known as plaque. Before a heart attack, one of the plaques just bursts or ruptures, causing a blood clot to develop at the site of the rupture. The clot may block the supply of blood to the heart, triggering a heart attack.